like to welcome the next speaker, Sarah Stephens from Duke University, presenting increasing early exposure of medical students to radiation oncology.
Thank you. I'm very pleased to be able to share with you guys some of the educational initiatives that we've taken at Duke to increase the exposure of our medical students to the field. I don't have any relevant disclosures. So I feel like I've gleaned that this is a theme of the day, trying to identify some gaps. And for us, when we were looking at this for our students, we felt like there were two potential gaps, an educational gap as well as an exposure gap. So that's where we've kind of chosen to focus our time. And before I get into that, I will just kind of briefly review our med school curriculum, because it is a bit different than your traditional curriculum. So our students come in, they have a year of classroom work, and then second year they go directly into the clinic. Third year they spend doing a dedicated research project or some sort of enrichment. It doesn't have to be research. And then fourth year they're going back into the clinic. And before we started this initiative, they did have the opportunity to do the fourth year elective. We just had a nice talk on that. Something that I think is a strength of our med school is that they also have the opportunity to do a 2-week elective during their second year, so getting some early exposure. But they are only able to do 2 electives, and so there's some triaging that happens in terms of what they choose to do during that time. So we chose to start targeting them early, so in their first year. So one of the benefits of being a pack rat is that when you're thinking about this, you, if you're like me, you could go back through all of your med school resources, which I did. It's the only time I convinced myself that it was useful to hang on to, because I would do that all the time. It's the one and only time I've done it. But this, I was a Duke medical student, and during my med school training, this is the only thing that was integrated into our curriculum. So we had a single slide buried in a lecture first year that briefly went over the difference between external beam and Reiki and mentioned DNA damage. So that was kind of where we were working from. So how have we chosen to deal with that? So we have partnered with some of our medical oncology fellows, and we have created something we're calling the Cancer Care Experience based on something they've done at Case Western. So this is an optional course for the students. It's 6 weeks long, and I'll kind of go through what they do each week. But after they complete the course, they do spend some time in clinic with an attending. It doesn't have to be a rad-onc attending, but it's an oncology attending or a palliative care attending. So during the first week, we talk about cancer prevention and screening. We go through the USPSTF guidelines with them, the American Cancer Society guidelines. We also have a week dedicated to diagnosis and staging, and all of these are case-based, as well as one based on treatment. And then survivorship, where we're bringing in patients and their families to discuss with them their experiences going through oncologic treatment. We also cover hospice and palliative care, as well as end-of-life issues. And then we also have a week dedicated to research, because as I mentioned, the students have the opportunity to participate in scholarly work, and just kind of getting them used to some of the opportunities that are available in this field. We've also targeted our second-year students, and our radiology colleagues have been kind enough to allow us some time. So all of our students are required to take a 4-week radiology rotation during their second year. And they have been generous enough to give us an hour-long talk. So now we've gone from 1 slide to an hour. So I was very happy with that until I was talking with Lisa at lunch, and she said they have 2 hours, and so then I felt bad. But I feel like this is a significant improvement for us, where Famika did it last year, and then myself this year, where we're going through the basics of radiobiology, physics, treatment planning, and simulation with the students, and it's been very well received. And as part of this, we've done a survey as well. I've just pulled some snippets so you have an idea of the type of questions we're asking. So asking a basic level of understanding. Do you understand DNA double-stranded breaks, scale of 1 to 5, 5 being you completely understand, as well as some true-false questions. What types of malignancies is radiation often used for? And so again, 5 being strongly agree. We've now surveyed 146 students. Our response rate has been 100%, but that's only because I force them to do it on paper and give them chocolate. So that has been very successful. I realize that is not practical in all settings, but that has been successful in this setting. So in terms of the biologic basis of radiation, they feel kind of middle of the road in terms of comfort level there. Not surprisingly, thinking about radiation from the patient perspective, as well as treatment planning and simulation, they feel much less comfortable with that. And then also they don't feel entirely comfortable with thinking about what types of diseases we're treating on a curative basis, as well as which kind of symptoms we often palliate with radiation. And then most of our students did not have any prior, about 80% did not have any prior exposure to the field, but we're starting to see the folks come through that did our first year cancer care experience. And then encouragingly, we're on the other end of the scale for whether or not they felt it was beneficial to have more of a structured implementation of radiation oncology into their curriculum. And one of my goals is to also get them involved in the third year. So by contacting them early on in years 1 and 2, they have to do a continuity clinic experience during their third year where they're returning to the same clinic with the same attending to try and continue their clinical education during the research block. And we're offering them radiation oncology as a potential space to do that. And then lastly, during their fourth year, for the students that choose to apply into the field, we've implemented some mentoring. An example of that would be this past year I did mock interviews with all of our applicants before the interview season, and that was very well received in terms of just kind of getting those initial jitters out of the way before they actually went out and interviewed. So thinking forward to the future, one of my current pet projects is we're finding we actually do provide them with some resources when they're in the department to read, but they're rather outdated and rather clunky at this point, so that's one of my pet projects. And then we'd also like to circle around after some of these initiatives have been in place to resurvey students and see how they feel we're doing in the come to them in the fourth year and see how successful they think we've been. So I'd like to thank my collaborators, Dr. Joe Salama, my mentor. This is, so just so you can put a face with a voice, this is Dr. Chino Famigo, who is joining us from North Carolina. And with that, I'm happy to take any questions.